Hi there, my name is Connor Howard and welcome to this virtual poster presentation. I will be presenting retrospective analysis of fire department call volume data. So firefighters live a unique life. They respond to very stressful situations, and because of this, you can imagine they have the potential to be at very high stress levels while they're on the job, and this has the potential to carry over into when they're not working. So with this in mind, we have put together an interdisciplinary research team consisting of an athletic trainer, a neuropsychologist, an exercise scientist, a nutritionist, and medical students to examine this and to answer the question, how does the lifestyle of a first responder truly affect them? So currently with this presentation, we'll be looking at the call patterns of suburban fire departments in Oklahoma, specifically focusing on the amount of calls they're receiving per day of the week for two departments in Oklahoma. So previous research has shown that due to occupational hazards, that overall health is extremely important for these first responders. Some of the previous research has looked at physical fitness, has looked at diet of these firefighters, and has looked at the sleep patterns of these firefighters. So looking at the question, do they get adequate sleep? In some previous research has shown that implementing injury prevention and health education programs has helped with physical and mental well-being of these firefighters while also reducing the medical expenses for these departments. So currently we are examining call data for day of the week and time of day for two suburban fire departments. So with this presentation, we'll be focusing on the call data for the day of the week. We collected data over a 4-year span from 2014 to 2019, and we were provided this data through the fire chiefs. The first community has a population of 23,216 individuals with 2 fire stations and 20 full-time firefighters. And this Department 1 does not have an ambulance service, so they're responsible for all fire and medical calls. However, the immediate patient care and transportation is provided through a secondary service. And the Department 2 has a population of 36,173 individuals with 4 fire stations and 50 full-time firefighters. And this department differs because it has its own ambulance service. We calculated the means and the standard deviations and performed a one-way ANOVA to determine the statistical difference between these two departments. So Department 1 is the smaller community listed above, and Department 2 is the larger community listed below. The graphs show us the average number of calls by day of the week, and as you can see for Department 1, they receive the highest amount of calls on Monday, whereas Department 2, they receive the highest amount of calls on Friday. So even though they have different demographics, different populations, and Department 2 has an ambulance service, we also noticed that the highest amount of calls were received between 2 and 3 p.m. So with this in mind, moving forward, we would like to analyze these firefighters in regards to their nutrition and their diet. So are they eating healthy? Are they hydrating properly? How much caffeine are they intaking to upkeep this lifestyle of being alert and responsive to these alarms and these calls that they're getting? We will be looking at their sleep patterns through a sleep study, seeing how their responsiveness and alertness is affecting their sleep. And with that goes with stress levels. As we stated earlier, firefighters have the potential to live at very high stress levels. We'll be looking at physical fitness levels of these individuals and examining whether their physical fitness levels do have a correlation with injury. We'll be looking at their behaviors on and off shift, and then we'll be trying to implement a health intervention and injury prevention and health education program to try to reduce the cost and improve the overall well-being, both physically and mentally, for these departments that we are working with. And thank you for joining me for this presentation.